Welcome to ADHD through the eyes of a psychiatrist. Here we go. I like to compartmentalize ADHD symptoms into two general categories. The first is inattention, and the second one is hyperactivity and or impulsivity. Starting with inattention, there's a variety of symptoms that go into this category. For example, being easily distracted or forgetful. These are folks who often do not seem to listen when spoken to and have difficulty following through with instructions. They will have difficulty organizing tasks and activities, and in general will avoid tasks that require sustained mental effort. If you often lose things, then this also can sometimes be indicative of an ADHD symptom. As for the hyperactivity impulsivity section, remember that it requires only one or the other and not necessarily both. But regardless, symptoms include being fidgety. These are folks who often will tap their foot or hand. They will blurt out answers prematurely or speak out of turn. People in this category will describe themselves as constantly on the go. They can talk excessively. They will also have some difficulty waiting in line or waiting their turn. An interesting thing that I've noticed in treating ADHD patients is that there's a group of ADHD patients who have a very high IQ and will compensate extremely well for their ADHD symptoms. And these are people who can kind of cruise through life without ever having a diagnosis of ADHD, but when you put the symptoms together, it's clearly what it is. So how do we treat all this? It's through therapy and medication. And I will say, as a psychiatrist, treating ADHD with medications tends to be a very fulfilling experience. This is something that when you treat, you tend to get pretty quick results that can be very profound for the person being treated.